Thank you, and welcome to the show this morning. The topic this morning is a conversation with members of the delegation from the state of Lagos in Nigeria. And of course, we have with us to talk about this delegation and some of the things that have been done since they arrived here, Dr. Adris, who is with the Ministry of Health in the state of Lagos in Nigeria. And of course, with Dr. Adris is Dr. Fequsa, who will also give us some information about health in Nigeria. And of course, Dr. Adris and Dr. Fequsa, let me welcome both of you to the show this morning.
Thank you very much.
And Dr. Adris, to tell you and Dr. Fequsa how indeed glad we are to have you here. And we know that you've been involved in a number of things over the last 8 or 10 days since you came to the state of Tennessee from Nigeria. And we also know that this was a very, very important meeting, and we want you and Dr. Fequsa to give us some information. But first of all, before we get started, let's have you to give Dr. Adris to give us some information about your background, your education, and some of the things that were important in terms of eventually leading you to the permanent secretary of the Ministry of Health. And Dr. Fequsa will do the same thing in reference to her career, and then we'll have an opportunity to talk about some of the real issues of health in Lagos, Nigeria.
Yeah, thank you very much. I'm a medical doctor by profession. I had my medical education principally from Nigeria, University of Lagos College of Medicine. And I came here in 1981 to do my master's in public health at your university. I stayed here up till about 1999 when the new democratic dispensation came into government and the Lagos state government was created. The governor invited me as a permanent secretary. And I decided to go back to Nigeria actually just to contribute my quota to the development of the state.
And so you're really involved in medicine at perhaps the highest level in Nigeria as the permanent secretary for the Ministry of Health. Now, the Ministry of Health, when we say Ministry of Health, exactly what are we saying here, Dr. Adris?
Well, Ministry of Health, basically, it's one of the departments, like you call them departments here. It's the Department of Health in Lagos State. The Lagos State government, we have about 18 ministries, and health is one of them. Basically, we handle all health-related issues. The ministry itself is divided. We have an administrative head, the Commissioner for Health, and I'm next to it. I have another colleague who is a permanent secretary but handles the hospital the management board. Basically, the ministry handles policy matters, regulations, and monitoring and evaluation. Also, we do monitor, carry out some programs which we feel are really health-related, especially addressed to the poor. The ministry itself is administratively divided into about 8 directorates, 6 of which are technical, and 2 support. When I mean support, I mean accounts and financial administration. And apart from that, okay, each director, the other 6 technical divisions carry out different programs depending on what your assignments are. Basically technical. I don't know whether you want me to go into details of that. Now, the other permanent secretary, who is also under the commissioner, handles the hospitals, basically hospital matters, hospital administration. And under her, you have the 19 secondary care facilities and 1 tertiary. And if you want me to give you give an idea of what the health system is like in Nigeria. Basically, in Nigeria, we run a 3-tier system, and all levels of government have their various responsibilities assigned. You have the federal that handles basically policy matters at the federal level and oversee the tertiary care facilities. The state government has responsibility for providing secondary care, health care, then oversee the local government affairs, especially more like supervisory capacity. The local government handles the primary health, that's the primary care level, basically, and that's just the first contact of an individual Lagosian to the health system.
Very good. And of course, Dr. Fequsa, what we're doing, we're making preparations, I would imagine, within the next minute for our first commercial break, which is to say we'll have a minute break between this, and then when we come back, we'll have you to give us basically, from your perspective, the same kind of information that Dr. Adris has given us, pointing out your responsibilities and the people that you interact with. I understand that you have been involved in the Ministry of Health for quite a while, and so we want to talk about that as soon as we come back. And of course, we'll be back with our audience following this very, very short commercial break. The topic